So I've been a CRNA for about 4.5 years now, and there's so many times, even now when I'm in the OR, I think back to different things that my preceptors said to me that have stuck with me and that I still think about, if not every day, weekly, and just like pretty often. So I decided to make a list of all the pearls of CRNA school that I can think of that were things that people said to me that were such little gems. I don't even think they realize how good of gems they are that I literally think of all the time in my practice. So I made a list on my phone, and let's see. So some of the things. So one of the things that has stuck with me is always having multiple blades available. So I'm a Mac girl. I intubate with a Mac blade, but when I was in CRNA school, I remember me and one of my preceptors were looking through the anesthesia card, and she was just kind of making sure that everything that was in the card that we needed for the day, different like syringe sizes, different medications, different LMA sizes. And she said to me, make sure always have different types of blades in your cart in case you have to emergency intubate somebody and you have to call somebody else in. If you can't intubate the person, you have to ask for help from one of your colleagues to have not only the blade that you like to use, but also other blades. Because if someone else comes in and they're like, hey, I need a Miller, that's what I intubate with, and you don't have it, then that just kind of slows down the process of the patient getting intubated. So to always make sure you're not just setting up the room for yourself, but setting up a room for an emergency situation. So if you need more hands on deck, that you have supplies for other anesthesia providers as well. And I was like, that's such a little good gem. So anytime I'm setting up my card, I make sure that I have other blades and other things available that even if I don't use them, that in an emergency situation, somebody else might use, to always have them. And then another one. Oh, and this is another, like all of these are so good. I'm like looking at them, I'm like, oh, that was such a good one, but all of these are pretty good. Another one was your first attempt when you're intubating a person should be your best attempt. So that basically means when you're getting set up, position the patient in an optimal position. Make sure if they are like a larger patient, to make sure you have them ramped up really well and have a glide scope available. Make sure that it's plugged in, make sure that it's charged. Just everything the first time you do it should be the best attempt. Like you should not have the first attempt be like, kind of like, oh, we're just gonna like see how it goes. No, your first attempt should be your best attempt. And yeah, I just think that was such a good gem to share, because I always think about that anytime I'm intubating a patient. Like, is this the best situation for them? How I have the room set up, how I have them positioned. And also just having things ready the first time, like as ready as you possibly can be the first time, just makes you feel more confident and reassured in the situation. And then another tip is, oh, this is a good one too. As long as you can mask a patient, as long as you can ventilate a patient, you do not need to panic. I remember in CRNA school, anytime where I, especially when I was first starting out and you have some intubations that you don't get, anytime I didn't get them, I was like, oh shoot, like I didn't get it. And I immediately am kind of like, I could feel myself kind of rushing and getting nervous, like, oh shoot, I didn't get it. And I know they're about to start desaturating. And I remember, I think it was the anesthesiologist and the CRNA in the room, and they were like, you don't have to panic. Can you mask the patient? They was like, can you mask the patient? And I was like, yeah. Well, as long as you can mask the patient and you can ventilate them, then that's fine. They're moving air. They're in a good situation, so you don't need to panic. And I was like, it just calmed me. So anytime, even now, when a patient is a difficult intubation, I just always can kind of center myself and not panic and not freak out, because I know as long as you can mask the patient, you're ventilating the patient, they are fine. And that just really stuck with me. And I think it was such a good thing for them to say to me in that time. And then another thing that stuck out to me was when a CRNA said something along the lines as, your energy affects the whole room. So as the CRNA, a lot of the time it's important to be cool, calm, and collective. And that's also important for like the surgeon or anybody in the room really. But I feel like as the anesthesia provider, if I'm not freaking out or if I'm not seeming disheveled, then it kind of helps control the energy in the room. So I'm always mindful of that. I always think of like anesthesia or being an anesthesia provider as being on stage, because your energy and how you're portraying yourself, everybody in the room is picking up on it. So I know that I don't want to be seen as the CRNA who's disheveled, easily frustrated, easily panics. I want to be cool, calm, and collective so everybody knows like, okay, she has this. So if I do seem disheveled or panicked, they know like, okay, there's something seriously wrong, because we never see her in that kind of state. So even I've gotten comments from like nurses saying like, I feel like every time, like barely anything goes wrong when you're taking care of the patient. And I was like, oh, thanks. Like, because it's easy for me to remember if a patient has a laryngospasm or if the patient takes longer to wake up than I had hoped for. It's always, it was something nice to hear that I'm known as kind of like a calm provider who's not panicking and easily irritated. And I think it is because that CRNA said to me that one time, make sure your energy isn't coming off as panicked, as anxious, as nervous, because people are picking up on that and paying attention to it. So I always try, even if inside I'm kind of like a little nervous about something, I always try to come off calm, and I always like can reassure myself too. And it's funny sometimes when I'm talking to the patient, I'm sometimes talking to myself. Like when I'm putting them to sleep, I'll say, okay, take some deep breaths. Like everything's looking good. Your vital signs are looking great. And it almost reassures me. Talking to them, calming them down, calms me down too. Because I'm saying, take deep breaths. And just naturally, I end up taking a deep breath too, just to like kind of show them like, take deep breaths, just breathe in the oxygen. And then also when I'm telling them, hey, everything's looking good, vital signs are looking great, it also is telling me like, yeah, everything's looking good, everything's looking great. Let's get this patient off to sleep. So yeah, me talking to the patient and calming them, also, it's interesting because it calms myself down too. It's interesting how that works. But yeah, I just think controlling your energy, having a calm, peaceful vibe really helps. Nobody wants to work with somebody who seems disheveled and anxious. It affects your mood. Even I've worked with surgeons who are very frustrated, very flustered, and it completely changes the mood in the room. Completely changes the mood. As like also for like a nurse, the circulating nurse, if she's disheveled, running around, or he or she is disheveled and running around, it affects everybody in the room. So keep your energy calm and peaceful. Do good self-talk. Meditate. Do what you need to do to come into work calm and peaceful. Another tip, and I can't remember if this was a nursing school or CRNA school, but your charting should always tell a story. Your charting should always be able to be looked at by another provider and tell a story. Oh, okay, like this patient, they intubated the patient, they were easy intubation. Oh, they used this kind of blade. It should tell a story of how the care of that patient went for you. And also, that's the same thing if you end up having to go into court or being called into court for a case. Your charting needs to tell a story also to you, so you can look back on it and be like, what was I doing? Why was I doing this? There's been times where I've looked back at a chart that I had, especially, for example, sometimes with cataract patients, they come back like a couple weeks later to get their second eye done. And sometimes I have been the provider for the first case, and I can look at my charting. They can like show you the charting just so you can copy kind of what you did if it went well. And I can look at my charting and see like, oh, was this good enough for the patient? Like, did I give them enough Versed and fentanyl for them to be comfortable? And I can kind of see in my chart, did I give an additional dose? Like within 10 minutes of starting the case, okay, maybe I need to give more this time around. So it just helps the next provider, if there is a second time they get a surgery or procedure, see what worked for them so it can work for you. And then also, if you are called into court, you can kind of look at your chart and say, okay, why did I do this? And did it make sense? It should always make sense to future anesthesia providers and yourself. All right, and this is the last pearl that I can think of. And if I think of more, eventually I'll make a part 2 to this video, because I think there's just so many gems. I'm pretty sure you guys have heard. So if you're a CRNA or if you are in nursing school and you've had like little gems that people have said to you that have stuck with you, leave them in the comments. But the last one is always look over the drapes when you're adjusting the bed height. And another thing is also have closed loop communication. That's another one. So basically, as a CRNA, you're in charge of adjusting the bed height, planing it left or right. You're in control of the bed. And basically, the CRNA who told me this was basically saying, make sure to look over the drapes, because sometimes there's like a Mayo stand or different equipment on the drapes or around the drapes that can get knocked or pushed over if you're not paying attention. And sometimes the people who are like the surgical tech and the surgeon are more like focused on the surgery, so they're not like looking at the Mayo stand. So sometimes if you raise the bed, it can knock over the Mayo stand. So just being vigilant and paying attention to those things not only helps like mistakes from happening, like I just said, like the Mayo stand or anything else falling over, but also it shows that you're paying attention. Like when I look over the drapes, like everybody kind of looks like, oh, she's like looking to make sure everything's going well. So it just kind of lets everybody else in the room know like, hey, I'm paying attention. And then I also just added on having closed loop communication. So if the surgeon says, bed up, I respond, bed up. So they know that I heard them. Sometimes they'll say bed up, but you don't hear them, because sometimes, especially in orthopedic cases, they have like these big, I don't even know what they're called, but not a helmet, but this, what is it, like a cape? I can't even think of what I'm trying to say. But this big thing on their head that protects them from getting blood splattered on them, since orthopedic cases, they're like hammering and blood can sometimes splatter. But it's sometimes hard to hear them when they have that on. So it's important to repeat back what they said, because sometimes they don't say bed up. Maybe they're saying like foot up or talking to somebody else. So I always try to say back what the surgeon is saying to verify it, and then just to let them know like, I'm hearing you, I hear you. And then I also, especially when you work with a surgeon enough, they kind of get used to you saying it. So if you don't say it, then they clearly know you didn't hear them. But those are my pearls of CRNA school and anesthesia. Those are things that literally I'm always thinking about. Literally, I'm always going back to these couple of things. And I'm trying to think, like I said, I'll make a part 2 if I can think of more things that people have said to me, but these are the main gems. Hopefully I can eventually be someone who is saying these gems to people, or have said gems to people that will stick to them throughout their nursing practice or anesthesia practice. But thank you for watching this video. Hopefully it is helpful. And like I said, leave comments if you have gems or pearls that you heard about in school that have helped you throughout your practice.